Good morning. My name is David Higgins, and I'm here representing PAN this morning, and would like to welcome everyone and take a seat and get a cup of coffee. Okay, a little louder. How about if I just hold it?
Okay.
First of all, I want to thank Sarah King, who is omnipotent and all-powerful, and arranged to have that earthquake for you last night.
It was fun, right?
Just for entertainment purposes. Anybody from out of town probably was absolutely terrified. But so as you look around the room, you'll see researchers, people with Parkinson's, clinicians, caregivers, loved ones, educators, advocates, friends. This room is filled with a diverse group of people that have as a common thread Parkinson's disease. My personal connection began when I was a young kid and I watched my grandmother suffer with Parkinson's. More recently, my mother suffered from Lewy body dementia and had about a 5-year struggle and died just this past January. Then, not to be outdone by my predecessors, about 2 years ago I was diagnosed with Parkinson's disease. And I guess you can say it's a family tradition at this point, but certainly a personal connection. I certainly expect to fare better than my grandmother and my mother did because of the work of some of the people in this room that are improving the lives of Parkinson's people every day. We're here today to share information, ideas, meet new people, make connections, with 3 very modest goals in mind. 1, make improvements in the quality of lives for people with Parkinson's. 2, develop better therapies. And 3, work toward a cure. So if we don't have that done by 11 o'clock, it's okay, but certainly by 3. But we have some exciting topics and speakers today, and so with these goals in mind, let's begin our day. And I want to introduce Sarah King, and I need to say a few words about Sarah, much to her chagrin. Sarah's official title is the PAN State Director for Southern California, but Sarah does all of California. So she is an incredible resource for PAN. She's the primary architect of today's meeting with a lot of help from other people you'll meet today. And she's dedicated to the Parkinson's community far longer than her time here in California. She's a mother to 11-month-old Susie, almost 1 year old, who we kind of have officially adopted as our mascot. She's a good friend, and she's going to tell you about today's events. Sarah?
Thank you. Thanks, David. I feel so short. I should have brought some pictures of our official mascot. If anybody wants to see baby pictures, I have lots. Always happy to share them. Thanks again, David, for the nice introduction. I'm going to get this close. Actually, I'm going to hold it. I'll tell you my Parkinson's story quickly. My mother had Parkinson's as well, and she, the first year of her diagnosis, progressed very, very rapidly, so rapidly that after the first year, her neurologist kind of reevaluated and diagnosed her with Parkinson's plus. And unfortunately, she died a mere 4 years after that, in 2010. And I got involved with PAN the following year after kind of searching my way through the landscape of opportunities to get involved in the Parkinson's community and discovering that PAN was really the best fit for my interests and my talents, I guess. And it's been wonderful. I'm really proud of the work that PAN does and really happy to be involved with them. And I'm really proud of the work that we are doing here in California. So thank you all for being part of that and for sharing your Saturday morning with us. I appreciate that. So why are we here today? We're here today, as David said, to talk about priorities in California for helping the Parkinson's community. We at the PAN grassroots leaders in California have been talking about this meeting for a while now, and I think this meeting has actually taken place before. John Ball could probably speak to that. But we've been talking about it since I joined the team in 2012, so we're happy to have put it together for you today. One of the things we talk a lot about is how big California is. We have 38 million people, and I think the 6th largest economy in the world. Someone can correct me if that's wrong, but even if that's off by a couple of numbers, it's still pretty big. We also have world-class private and public research institutions, and we have, I think, a really unique and innovative approach at the state level to funding research through things like CERM, who you'll hear from later today, and through initiatives like the CalBrain initiative that's just been introduced in the State Senate, I think, in January. So we're poised to remain a leader in the field, and we in the Parkinson's community, I think, really have to make sure we are staying on top of these things and that Parkinson's doesn't fall through the cracks, that it is a part of that conversation and a part of that funding structure. We also want to make sure that everybody with Parkinson's in California is served, has the care that they need. You know, we have a lot of resources available, but they're spread out. They can be difficult to connect to if you're not in San Diego, Los Angeles, or San Francisco. You may have a hard time finding things like support groups, like movement disorder specialists. So we have a goal to connect people to the care that they and resources that they need, no matter where they live in the state. You know, I think we've all seen through our work with PAN at the national level that the way to accomplish this is to organize and to advocate. And along those lines, and with a nod to the way that PAN works as a coalition and in partnership with the other national Parkinson's organizations, we, the grassroots PAN leaders in California, have formed the California Parkinson's Coalition. We're very excited about this, and what we're envisioning is a network of people involved in all aspects of Parkinson's care, researchers, caregivers, patients, of course, people involved in resource and support organizations, coming together to form a network to communicate, to share resources, to share information, and to work on advocacy issues, to work on legislation where appropriate, you know, to get the funding we need, et cetera, et cetera. So we've invited you here today because we think you will be interested in being a part of that. I hope that's true. Otherwise, I don't know why you're spending your entire Saturday with us so early. We're going to call on you to help us. So be forewarned. Our first step really is today, is to get together, to get kind of educated on these issues that we see as priorities, and then to figure out how to move forward from here on out. So thank you again for being part of that. A couple housekeeping notes before we get going. We have solo presentations today and we have panel discussions, and if we stay on time, we're going to have time for a little, short Q&A session after each segment. We've got a long day, and we're going to keep it moving pretty quickly, but we do have some breaks built in, and if you need to get up and use the restroom, which are back by the elevators, please feel free to do so. There is Wi-Fi in the room, very important. There's the password there, the username and password. Oh, you'll see it again. Write it down when it comes up again. And I think there are power outlets, throughout the room if you need to charge your devices. The packets on the table, the white folder on the bottom is your homework. That's some background and resources on all the topics we're discussing today. And the packet on top has the agenda, the speakers' bios, and where we had them, the printouts of everyone's presentations for you to take notes on. Lots of people to thank for today. Lots and lots of people. First of all, the members of the PAN team who worked so hard to put this event together, who are here today. David, who you met. Aurora, who's in the back. Neptune, who's up front here. Bill Clinch, there's Bill. Mark Siegel. Mark is somewhere too. Thank you all so much for being here. And there's some members of the PAN team who aren't here today who I also want to be sure to thank. Greg and AJ Wasson, who many of you probably know, very important part of our team, live in Northern California, couldn't make it today. And Robin Katseros and Sue Buff as well, who are in Northern California, and really did a lot of work to put this together, but unfortunately couldn't make it. PAN staff in DC, we owe a lot to them. Jennifer Sheridan is here from PAN today, all the way from DC. Thank you so much. PAN's really been supporting us in kind of stepping out and embarking on a statewide advocacy initiative. And really, they're the model for what we want to do. So we owe them a lot, not just for their support and encouragement, but for being who they are. Special thanks to David Miles and John Lynn for being our AV experts today. I definitely could not have gotten my head around any of that stuff, so thank you so much. Thanks to the speakers for your commitment and your patience. This event, it came together pretty quickly. I think we started planning it in January, but it started with just kind of the seed of an idea and sort of evolved and changed over time. So I thank the speakers and presenters for your patience as we kind of navigated that and changed formats a couple of times. Very, very special, very important thank you to Medtronic, our sponsors for this event, because we would not be here, certainly, without them. And I especially want to thank Alex Hemme, who's in the back, and I think, yes, she deserves applause. A lot of you, everyone I think knows Alex, and she knows everyone, and she's so generous with her time and her knowledge, and just, she helped connect us to a lot of people. She's the reason I think a lot of the speakers are here today. I mean, she's just extraordinary. Thank you so much. And thank you also to Robert Simpson from Medtronic, who has traveled in from Salt Lake City to help clear up some of the really confusing aspects of healthcare and barriers to healthcare. So before I turn over to Jennifer, who is going to talk to us about PAN's work and upcoming priorities, I want to share something with you from Greg and Ann Wasson. They were really disappointed that they couldn't come today, and they asked me to read a special letter to you, which is also in your packet, but I do want to read it out loud because I think it, in a lot of ways, it says what we all want to say here today way better than we could. So if you'll indulge me. Dear friends and colleagues, it is our misfortune that we are unable to participate in person with you in this, the first California Parkinson's Disease Advocacy Summit. But we are there with you in spirit, and we are committed to helping make this collaboration a great success. A dozen years ago, we began actively advocating in California on behalf of the Parkinson's community in general and the Parkinson's Action Network in particular. We helped represent the patient's voice in the effort to legalize stem cell research, to fund that research through the passage of Prop 71, and to require the creation of a statewide mandatory Parkinson's disease registry. We're going to talk about that later today, side note. We met with support groups to enlist members for PAN's grassroots army. We worked shoulder to shoulder with many others, some of whom are here today and others who cannot be here. California, both North and South, has traditionally had a large and active contingent of Parkinson's advocates, and we are proud to count ourselves among them. Times have changed. The Parkinson's community recognizes the need here in California and across the country to refocus its efforts and to rededicate itself to the fight against PD. Our goals remain the same as they were 5, 10, and 20 years ago: to learn more about the disease and how to better treat it, to relieve the suffering and ease the burden of those affected by it, and ultimately to count Parkinson's among the many diseases which are now only a memory. To achieve these goals, we must all listen as well as speak. We must listen to the patients and caregivers who have the disease, to the researchers and physicians who have made Parkinson's the focus of their professional lives, and to the organizations dedicated to helping in the battle against PD. In so doing, we will overcome obstacles to collaboration and forge lasting alliances that will allow us to make progress more quickly. To this end, we encourage you to make the most of your day-to-day. Talk to each other, listen to each other, learn from each other. Those of us who cannot be there trust you to represent us all. Thank you for your efforts. Those of you who have been with us all these years, thanks to those of you who have been with us all these years, and thanks to those of you who are new to this endeavor. We have many riches in California, and you here today are among the most valuable. Work hard and enjoy. AJ and Greg Wasson. I just thought that was lovely and wanted to share it. Thank you. Thank you for listening. And Jen is going to join us now. Thanks.
Okay. Thank you so much for having me here today. Can you hear me? Am I going to need to hold it? Okay. So thanks to the PAN California team for setting up this great event, and particularly Sarah King for her leadership. So my job today is to talk about the Parkinson's Action Network and our work at the national level, just to give you a sense of how we're organized, some of the policy issues we're currently working on, and a little bit about our grassroots network, just as a platform for the policy work that we're going to be talking about at the state level. Is it this one? So what is PAN? PAN is the unified voice of the Parkinson's community on public policy issues, with the ultimate goal of finding a cure for Parkinson's disease. And PAN is a very unique organization in that we represent a variety of stakeholders in Washington, D.C., including 4 national Parkinson's organizations like the Michael J. Fox Foundation, the Parkinson's Disease Foundation, the National Parkinson's Foundation, as well as the Parkinson's Alliance Parkinson's Unity Walk. And we also represent people with Parkinson's, researchers, clinicians, all with the goal of making sure that Congress and the administration understand Parkinson's and the work that needs to be accomplished so that we are no longer fighting this fight. Many years ago, the organization, the national organizations came together to say that PAN would do our policy work. So what makes this unique is that many organizations or many other disease organizations or disease communities have multiple national organizations, and each of them has their own little policy shop or lobbyist in Washington. So a great example is the Alzheimer's community. So you have the Alzheimer's Association, you have Us Against Alzheimer's, there's another one, and they each have their own public policy team, lobbyists, etc. And they all kind of ask for slightly different things when they go to Capitol Hill. What makes the Parkinson's community unique is that the national organizations that we do have, there's only one that goes to the Hill. There's only one that talks to the White House. And so that makes us really powerful in that instead of having multiple people knocking on doors asking for slightly different things, we're all talking about the same thing and we're all talking about it in one voice. That makes us very unique, but I think very powerful. So a little bit about our history. Greg and AJ's letter actually kind of nicely talked about the work that he and his wife and the California team have done. Our actually history started in California. We were founded by a young lawyer who was diagnosed with Parkinson's disease, Joan Samuelson. And she was kind of appalled that the federal government wasn't funding enough research on Parkinson's disease when she was diagnosed. And so she took it upon herself to create a grassroots organization solely focused on getting the federal government to pay attention to Parkinson's disease. And so that's kind of how we were founded, and we continue to have federal funding for Parkinson's disease to be a key pillar of our policy work since 1991. So just a little bit about our organization overall. We are a 501c3 educational charity with a staff of 12. We are located in Washington, and we have an annual budget of about $2.2 million. I think what makes us, as I said, unique is we have the 4 national organizations that work with us and sit on our board of directors, and they provide about 30% of our annual funding. The rest of our funds come from private donors, pharmaceutical companies, and other grants that we go after. We have 3 main programs. Education, always important to make sure that we're pushing information out, and we do that through webcasts, an annual email or a weekly email, and our website, other activities, our policy work, which I will spend most of our time talking about today, and then our grassroots outreach. That's a network of volunteers throughout the country who are working on the ground on Parkinson's issues. So our policy work is multifaceted. Some issues are solely focused on Congress. Some are solely focused on the federal administration, the executive branch, and some are a mixture of both. We also have policy issues that are led by PAN staff. So I'm the director of policy. I have 2 staff people that are registered lobbyists that are on the government affairs team. So some are just led by my staff. Some of those are often, either time sensitive or we're doing kind of behind the scene conversations. And then there are others that are grassroots led, and that's where we really do kind of the beginning legwork and then throw it out to the grassroots to really harness support for an issue. An example of something that's staff-led is the FDA recently approved Northera, which is droxidopa, to treat NOH, which is a drop in blood pressure for people with Parkinson's and multiple system atrophy and autonomic failure. Before it was approved, it actually was put forth to an advisory committee where they review the drug and recommend whether or not they think it should be put to market. The panel that was put together was not based on neurology. It was based on cardiology. And one of the things that we were concerned about was, well, if cardiology committee is going to look at a drug that's going to be used in mostly neurological conditions, wouldn't you want to have a neurologist on the committee, right? So there wasn't going to be one. So we wrote a letter to the FDA basically saying it's important to have a neurologist, have their expertise on the advisory committee, and we want to make sure that you understand that this is an unmet medical need for Parkinson's disease. So we wrote the letter, very simple to do, and 3 neurologists were added to the advisory committee when it was reviewed. So just an example of something that we wouldn't have kind of put that out to our grassroots because it was more of an inside baseball, very quiet behind the scenes activity. But it was really important because we wanted to make sure that the advisory committee was the right committee to review the drug. So a little bit about some of the current issues that we are working on. Let me start by saying that we do a lot of funding work, federal funding work. And for anybody who's paid any attention to anything that has to do with the budget and funding at the federal level knows the last couple years have sucked. It has been very complicated over the last couple of years as there's been an extreme focus on deficit reduction and with sequestration across the board cuts that were put into place in 2013. It has made the process very frustrating, and I think from either my standpoint as a federal lobbyist to people on the ground who are working with their members of Congress, it's just the whole thing, it's just been frustrating. But at the end of the day, it's really important that we continue to work on securing research dollars for the National Institutes of Health. They are the largest funder of science in the world. They fund about $30 billion worth of science. And in 2014, which is the last fiscal year, we got about $1 billion increase. Doesn't put us to where we need to be, but it's a good start in the right direction. So we've already started. So in December, Congress passed a 2-year budget agreement, which kind of set funding levels for fiscal year 2014 and fiscal year 2015. And I'm not going to get into all the details because it would take the entire talk. But it set the groundwork for fiscal year 15 to actually be one of the first times in the last couple of years where we can see something called regular order, where we will actually see the committees that are responsible for funding the federal government actually have conversations about what are priorities, what programs should be funded, what are those funding levels. We'll actually hopefully see appropriations bills actually brought to the House and Senate floor for consideration. And so we're very excited that this process might move forward as it should. And so they are already starting on the fiscal year 2015 process. Traditionally, the president's budget really kicks this process off. But I think there's 2 things to remember about the president's budget. It is not binding, and it is just a recommendation of his priorities. And so he is actually recommending for the National Institutes of Health a very modest increase for the National Institutes of Health. It's about $200 million increase. And what's unique is that he's actually, on top of kind of the traditional funding, he is providing $970 million in what's called supplemental funds. And this was his way of saying there are budgetary caps. I'm getting too wonky, but there's budgetary caps or ceilings that Congress has to abide by. And so his modest increase kind of fits in those caps. And what he wanted to make sure Congress understood was that there are a lot of things that he thinks should be funded above those caps. And so he proposed supplemental funding. And so he wanted to have almost $1 billion provided to NIH. And so that was kind of his marker to say, I think NIH is a priority. And unfortunately, under the caps that or the restraints that I'm under, I couldn't do that. But he wanted to kind of put it out there. Unfortunately, Congress isn't going to be too happy about it providing additional money above those caps. So we'll see how it works out. But ultimately, it's nice to see that the president did have NIH as a priority. PAN, along with others in the research community, are advocating for $32 billion for NIH in 2015. And that work is going well so far. We're going to be probably pushing out additional information on supporting that request soon. But we are excited about getting that work underway. I think the one thing I wanted to mention, because of the funding process, NIH actually just updated their Parkinson's disease funding levels. So this is what Parkinson's disease received at NIH in fiscal year 13, and we did actually see a 12% decrease. So NIH is currently supporting about $135 million in Parkinson's research. Two kind of explanations for that are sequestration. NIH saw an across-the-board cut of 5.5%, so that's a nice chunk of change. And so ultimately, they provided less grants out to researchers across the country, and so that explains part of the number. When we looked at all the funding charts, those cuts were very similar to cuts that were seen in other neurological conditions. So for instance, I think epilepsy saw a 13 or 14% cut. Huntington's, I think, saw almost a 20% cut. So while concerning, because you obviously want to be increasing that number, I don't feel like NIH is trying to not fund Parkinson's. I didn't get that experience. The other thing about NIH is in January, they actually held a Parkinson's planning meeting. This brought together scientists, patient groups, patients, to talk about what are the key hurdles and opportunities around advancing Parkinson's disease understanding and treatments. It was a 2-day event, and 31 recommendations were put forth, and I believe in the awesome packet that Sarah put together, the white folder, you have 2 documents on the planning workshop. One talks about all 31 of the recommendations, and the other is a summary document that talks about the key 9 top priorities that were put together. We're going to kind of wait and see how these recommendations move forward. But we're planning on being very forceful, whether it's with NIH or with Congress, to make sure that they understand that there's a lot of work that has to be done in Parkinson's. And we know that there are limited dollars, but those limited dollars should go towards understanding the key priorities that were identified by this leading group of people. So we've done a lot of work in Congress educating people about the recommendations, about the opportunities, and then directly working with the agency to see kind of what's that next step. How are they going to be identifying those opportunities to move the recommendations forward? Is it going through their grants and seeing who can fund that particular priority, or are you putting additional dollars on the table to focus on a key area. So we are actually working on specifically increasing dollars to the National Institutes of Neurological Disorders and Stroke, which is something that we haven't done a whole lot of in the past, and we'll see how it goes. I don't know how many of you know that there is actually a Department of Defense Parkinson's research program funded by the U.S. Army. It was created in 1997 by Congressman Joe McDade, who is a House appropriator who was diagnosed with Parkinson's disease while he was in Congress. And one of the things he did before he left office was to establish a congressionally directed program at the U.S. Army. And the Parkinson's community has successfully secured funding for this program since 1997, which is about $370 million. And it's dual use program. So every grant that goes out has to have a military application and a civilian application. And they are committed to making sure that they're funding the best and brightest science out there, trying not to duplicate what's happening at the National Institutes of Health. But it's been a great program that we do a lot of work on, because without Congress understanding that it's there, that it's doing great work, the program wouldn't continue to see that funding. So we are currently working on securing $16 million for the program. As I said, Congress is working on the appropriations process now. And if you've gotten any of our action alerts over the last couple of weeks, you saw that Congress is working on a letter supporting that $16 million request. And if you were nudging your House members to sign the letter, as of, I think, Thursday evening, we had about 45 signers, which is fantastic, bipartisan. That letter goes to the committee that's responsible for funding the program and is a great pillar of support moving forward.
Is the deadline for that?
The deadline was Friday.
Oh, it was Friday, though.
Yeah. Thought it might be helpful to just spend half a second on California. You guys are a powerhouse in terms of research, and so it's pretty amazing to see that NIH actually funds $3.3 billion worth of research in California alone, and that shows the amount of institutes and work that's going on in the state. About approximately $10.5 million in Parkinson's research has been granted by NIH, and that's a fiscal year 13 number. And there is I think a state page that was included in your packet that summarizes this information.
It's in
The white folder, I think.
it's in the white folder in the California Funding for Research section.
And we have had, I'm looking at Carly Tanner, she's received funding from the DoD program. So we've had good work going on from California for that program. And then I just wanted to mention at the VA, and Carly's now at the San Francisco PADREC, there are 6 Parkinson's research and clinical centers located throughout the country that provide Parkinson's care to veterans. They are connected to a network of consortium sites. I think there's 51 consortium sites that are located throughout the country that are dedicated to providing care to Parkinson's vets. And so you guys actually have a great list of folks. I mean, California's gargantuan, so you need the support, but there's a lot of places where our veterans can get great care, and so if there are veterans who don't know that they exist, then that information is helpful. So moving forward, I need to speed it up a little bit. So we do a couple of things with the Food and Drug Administration. As you guys know, they're responsible for reviewing new drugs and devices before they go to market. And I actually kind of have a little crush on the FDA in that they're a pretty amazing agency when you think about it, because they actually regulate 25% of every 25 cents of every consumer dollar. So think about that. The food that you ingest, the drugs that you take, the food that your dog eats, all of that is regulated by the FDA, and they actually have a pretty tiny budget in comparison. They have about a $2.55 billion budget right now. They do get industry user fees. Those are fees that are paid by private companies when they put in like a drug application. But it's pretty incredible that with that amount of money, they do a whole heck of a lot of work. And so we do work on federal appropriations for FDA to kind of meet the increasing needs that the agency is met with. And we do that in coalition. They've also, over the last couple of years, focused on better understanding patient risk and benefits. So when a new drug or device is put on the market, what are you willing to risk to get access to that drug? They do this whole formula about understanding the risks and understanding the benefits of that to a certain population. And so they're trying to kind of dive in to better understanding that. And they're actually doing 20 disease-specific meetings on different communities, and Parkinson's was picked as one of them. So sometime either later this year or in 2015, there will be a meeting on Parkinson's and Huntington's that will bring together people to talk about what is Parkinson's, what are the symptoms that really hurt people, what kind of treatment improvements do we want to see, and what kind of risks are you willing to take to get access to a certain type of drug. So that's going to be really exciting. The other thing that we're currently working on is Social Security proposals. There was a proposed rule that was put out by the Social Security Administration that would update the medical criteria used when a person applies for disability. And this is very exciting because they haven't overhauled these criteria since 1985. And so they have a very archaic look at Parkinson's. For instance, you actually should have, for the definition, tremors on both sides of the body. It's not exactly most current look at the disease. And so the proposal is actually putting new functional criteria and new a more focus on understanding the non-motor symptoms of the disease and what would actually impact one's ability to work. And so we're actually pulling together a group of clinicians to better understand what the impact of the proposal will be, and we'll be providing comments to the agency sometime in April. So probably need to speed up, so I'm sorry. Obviously, Medicare, big issue for our population, a lot of folks getting care through the Medicare program. One of the main issues that we've worked on is access to therapy services, whether that's speech, language, or occupational therapy. Medicare has lots of weird rules, but one of them is that there's an annual cap on the limit, or annual cap on the amount of therapy services a Medicare beneficiary can receive each year. It's only $1,900. It's not a whole lot of money. There is an exceptions process that Congress puts place each year, but that exceptions process is kind of crappy. Some clinicians don't actually, some providers don't actually understand it or know that it exists. And then patients don't know to ask for it. And so some people are denied medically necessary therapy services when they reach that $1,900 cap. There's been an opportunity in Congress to permanently repeal the Medicare therapy cap, and we've been doing a whole lot of work around that. And just this past week, there was a bill that was considered by Congress that did include a permanent repeal. It's still moving through the process, but we'll see where it goes in 2014.
Can you make sure we all know that, so that we can lobby our own, local representatives to, vote to repeal that?
Yeah, we actually, I don't know if you receive our emails, but we've sent several in the last couple of weeks that are on that specific topic.
There's a page in the packet about it too.
Okay.
And
About how to-
I know I'm probably going to run out of time, so, but yes, I can talk a little bit more about our alert system. But it is very important because we know that access to therapy services is critical for our population, and we want to make sure that we're part of the package that moves through Congress, because this is our one opportunity to fix it. The other two I will not talk about because I think telemedicine is a little bit more important, since I know we're going to be talking about it later today. Telemedicine is the use of technology to see your physician. Some of it's Skype-like technology where you are sitting in front of a computer talking to your doctor. For Parkinson's, there was a study that came out a couple of years ago that said that 42% of people with Parkinson's were getting their care from a primary care physician. Nothing to say wrong about primary care physicians, but they don't have the specialized expertise to treat Parkinson's. And the study went on to show that you actually, by seeing a neurologist or a movement disorder specialist, actually had an improved quality of life, and you were actually going to will live longer. And so one of the things that we want to see is increased access to specialized care. But the way that our country is set up, some rural communities don't have a movement disorder specialist. In fact, the state of Delaware does not have a movement disorder specialist. And so we see telemedicine as an opportunity to get people access to the right care at the right time. Unfortunately, the way that every system is, it's complicated, particularly in the Medicare system. There are rules and limits on what can be reimbursed by telemedicine, where the physician and doctor has to be licensed. And so we're working to kind of knock down some of those barriers. I think what's unique about this opportunity is there's a lot of work going on at the state level. There are some states that have said that private insurers have to reimburse for telemedicine visits. And so there's a lot of work going on at the state level to kind of knock down some of those barriers, which I think is nice to see, because the more states that kind of put it into their healthcare system, the more pressure that's going to put on the federal level. So we're going to be doing a lot more work in this area at the federal level over the next couple of years. And there are two bills that we have supported that are focused on removing the licensure hurdle. Basically, what that means is that to be able to see a patient by telemedicine, the doctor has to be licensed in the state where the patient is located, which means that doctors often have to have multiple state licenses. So there's a doctor, Dr. Ray Dorsey, who used to be at Johns Hopkins that now is at Rochester. He's licensed in 5 states. Including California. It's a complicated process. It's expensive. And so, that's something that you have to be really dedicated to want to do this. And so one way to do that is by, if the licensing system in one state is very similar to the other state, is there something we can do to kind of have like a national license, that one license is good for every state. So that's kind of what the Telemed Act is going after. So I'll quickly obviously the Affordable Care Act has made drastic changes to our healthcare system, and many of which we still are trying to figure out what they mean for the changes of the system. We've done a lot of educational work, just making sure we're pushing out information about what provisions might impact our community. And I have to say, for us, we haven't gotten a whole lot of questions or heard many concerns about accessing care through the state exchanges that have been set up. But we are very aware that we might be missing something. And so one of the things that I was going to ask is, if you're hearing people with Parkinson's who are struggling with the care that they're getting through the state exchanges, we need to know that, because then we can, at the federal level, there's going to be a whole lot of work to make minor tweaks to the Affordable Care Act over the next couple of years. And if there's something like not having access to a neurologist because the plan's network is too narrow, we want to know that. And we know that there are a lot of people who are on the Medicare program, so they aren't worried about the Affordable Care Act so much. But we want to make sure that we're making sure that our folks are getting the right care. The VA, there is a new program that was put in to extend benefits to veterans that suffered a traumatic brain injury and then developed Parkinsonism. So those are currently being implemented. And then for data collection, a couple of years ago, PAN worked on a piece of legislation called the National Neurological Surveillance System Act, which was aimed at collecting incidence and prevalence data on Parkinson's, and we partnered with the National MS Society. That effort would have created a data collection system at the Centers for Disease Control. It actually did pass the House of Representatives in 2010. It got caught up in the Senate by some unfortunate concerns that were brought up by one senator in particular, so it did not pass. And since then, it's been very hard to move public health bills through Congress, and so we actually did not introduce that piece of legislation this Congress, and have been working with the National MS Society to figure out other strategies to collect national incidence and prevalence data on Parkinson's. We pulled together a scientific advisory council that's putting together recommendations on what are the best avenues to collect the data, what does that system look like, and how do we do it in the most cost-efficient way. And that will be kind of the starting point for additional work, either with the CDC directly through some sort of public-private partnership or with Congress. So that work continues, and hopefully the June advisory council meeting, our scientific meeting, will be kind of helpful for kind of moving that work forward, which has been a little slow. So you guys have a big state at the federal level. You have 53 House members, and so a lot of work to be done, but some great champions. There are 17 members who sit on the Congressional Caucus on Parkinson's Disease, which is a group of members of Congress that come together to work on Parkinson's disease policy. And as I said, we have a grassroots network. These are folks that dedicate their time and energy to working in their states and with their members of Congress on the issues that are important to us. A lot of that work is doing action alerts, setting up meetings with members when they're back in the district, talking to support groups about PAN and some of the policy work we're doing, and just getting out there and talking about Parkinson's and educating. You can spend as little or as lot of time as you want. An e-advocate is someone who takes their opportunity they get our emails, they send a note to their member of Congress, and then they're done. They spend 5 minutes, every couple of weeks. All the way up to somebody who's like Sarah, who is pretty much dedicated her life to California advocacy work. So there's a place for everyone, and you don't have to spend a whole lot of time. But we do need more people involved. And so if you don't receive our alerts, I encourage you to go to our website and sign up. It's very simple. And then you get all the information about all the work that's going on that I didn't have time to talk about.
We are actively recruiting in California.
And we're actively recruiting in California.
I need more assistant state directors so I can get some of my life back. I do have a daughter.
So we send alerts. So this is actually one of the ones that we sent last week on therapy caps. The Senate was poised to work on a piece of legislation that I mentioned that would include a permanent repeal of the Medicare therapy cap. And so we sent an email. We know that there were lots of calls made, which we were thankful for. But you get an email, you click the Take Action button. We give you background on the issue. We even write the message for you, which you can personalize should you choose. And then you click send, and then you're done. We also provide, what I didn't show, we also provide sample tweets. So if you're a Twitter person, all you have to do is copy and paste, plug it in, tweet your member. Very simple. We have a whole lot of folks in California who do some fantastic advocacy work for PAN. As Sarah said, I think California is huge, so we have a lot of districts that are missing. So after this, if you're interested in getting involved with PAN, come find me. I can, hook you up with more information when I get back in DC. We'd love to have you. And that's it. And sorry, I ran over, so I don't know how much time.
We have, a few minutes for a couple of questions. If
Yeah.
we've got a mic, if anybody needs it.
And for any questions, there was a bunch of information that Sarah gave in the white folder that talks a little bit more about our work on a lot of the issues that I talked about. And we have a bunch of information on our website. And as I said, we do a weekly email on Fridays that talks about kind of what the latest and greatest is happening in DC. So that's a great way to stay connected to us. And obviously we're on social media should you want to follow us.
Thanks so much, Jennifer. We're going to take about a 10-minute break to set up for our panel on research, which is going to be a heavy one. So refuel if you need it, but be back in 10 minutes. Thanks.